Hello, everyone. Thank you for joining us today for our fourth annual Public Policy Summit, presented by the American Association of Kidney Patients. My name is Richard Knight, and I have the pleasure and honor of serving as the president of AAKP. The mission of AAKP is to educate and advocate, where we bring patients to the table for important discussions about health, promoting community, and AAKP always is inclusive of minority and underserved populations. AAKP's foundation is in fact steeped in advocacy. It was in 1969 we were founded by 6 dialysis patients who came together in support of one another and to provide a resource for others dealing with kidney issues. We have been involved in legislation and regulatory issues impacting kidney patients since day one, and we continue to do so today. It was in 2015, Paul Conway, past president, a transplant recipient, and most importantly, my good friend. It was then when Paul Conway and myself came together and we established the national strategy for AAKP, which we implement through 2 national centers. The first center is the Center for Patient Engagement and Advocacy, and the second center is the Center for Patient Research and Education. We work in full collaboration with our many national allies, investors, private sector companies, where we drive care and innovations and changing the status quo for kidney patients. It is our pleasure to have you join us today. And I'd like to give a special thank you to the many patients who are here with us today, as well as our esteemed lineup of speakers who you will hear from throughout the day. I would like to thank also our 2021 Policy Summit sponsors who have helped make this great event possible. First, our gold sponsors, CareDx Inc., Sanofi Genzyme, Travere Therapeutics, and Baxter. Our silver sponsors, Akiba, Bayer, CSL Behring, Natera, and Otsuka. Next, our bronze sponsors, Ardelyx, Horizon Therapeutics, Novartis, and our support sponsor, who's AstraZeneca. We have a great program today, and we will cover issues such as the COVID-19 vaccine and its implications for transplant recipients. We will discuss enduring kidney patients, ensuring that kidney patients have access to their medications and treatments, negative implication of quality adjusted life years. We will talk about equitable access to genetic testing and other innovations that are on the national horizon, and that's just to name a few. But before we dive into the program, I would like to introduce a special guest. And perhaps there is no more powerful explanation of what AAKP is all about and our impact on policy than insights from the sister of our former Board of Directors member, Brian Hess, who is also a good friend. Brian sadly passed away in December of 2020. Miss Laura Hess, Brian's sister, she joins us today to share a little about the huge impact Brian made and continues to make on the kidney community. Laura, thank you for joining us today. The floor is yours.
Brian was a passionate advocate who honored all kidney patients through his courage, tenacity, and sense of urgency for treatment innovations that would change outdated status quo kidney care and help save other people from suffering from this terrible disease. Brian knew that hope and innovation alone were not enough to bring life-saving treatments into reality. It also takes advocacy work on Capitol Hill in front of elected leaders to influence policy. For his efforts, both on innovations like the artificial kidney and advocacy, Brian was one of AAKP's finest advocates in all its 50-plus year history. Brian and I were brought up understanding the importance of being part of something bigger than the self, to give our lives meaning and purpose. His belief in God and knowing that God had a calling on his life spurred him on. Many times others thought Brian was close to death, but he knew he was not because he believed God was not finished with all that he wanted him to do. I am very proud he was a person who knew that his voice, the independent patient voice, was far stronger and more impactful than any paid lobbyist seeking a special favor for a special interest. To Brian, advocacy was not a game or an avenue to gain power or fame. It was his way, as a patriotic American, of helping save the lives of his fellow citizens. In the last decade of his life, despite suffering great pain and discomfort, he contributed to some of the largest victories and advances in kidney care. In 2013, he walked the halls of Congress to help gain passage of legislation allowing HIV-positive organ transplants for HIV-positive patients, which would help to reduce discarded organs and increase life-saving transplants within the HIV and AIDS communities. In 2018, after years of effort, he helped secure new protections for living organ donors under the Family Medical Leave Act from the U.S. Department of Labor. In 2019, he was part of the Dynamo AAKP team that helped push the White House executive order on advancing American kidney health, and was proudly in the room when President Trump signed the historic policy reform, creating great patient care choice and treatments and support for Brian's passion, the artificial kidney. Finally, throughout 2020, in the midst of the COVID-19 pandemic and despite his increased suffering, Brian used his social media presence to organize his friends and other patients to help gain congressional approval for lifetime coverage of immunosuppressive drugs, the culmination of a 20-year policy battle by kidney advocates. Brian was a loving son and brother, an optimist, a dreamer, and he loved to laugh, but he was so much more than that. I'm honored the world got to see the best side of him, the courageous young person who lived a bold life despite his disease. He was an inspiration through his bravery and relentless desire to make a difference for others. So when you think of my brother or any of the work he's done, I hope you remember one of the most important lessons of his life. The voice of a single person, especially a patient voice, can and does make a difference in the lives of others. To Brian, he knew his life and his voice would make a positive impact on people he knew, and just as importantly, on those yet to be diagnosed. Thank you for remembering my brother, Brian Hess.
Laura, thank you for those insightful and moving words. And I want you to know that we are pleased to dedicate this fourth annual policy summit in honor of Brian. Now let's take a few minutes and we share with you a memorial video that we prepared about Brian.
My name is Brian Hess. I'm a kidney patient from Oklahoma. I've been one since I was 6 years old, and that's over 30 years ago. And I've also spent the last 21 years on dialysis. For me, patient engagement would mean taking the patient's opinion and thoughts into consideration. Don't just deciding for them and not even hearing what they have to say. They're the ones that have to live with it, so they need to be the first and last person that are talked to in regards to anything that's going to directly impact their lives. First, I would use my own life story as an example that I've grown up with this and lived with this, and I've seen so much and seen so much not change in all my years, and also point out to them that before I was born, there's maybe a few thousand on dialysis, and now we're up to 700,000. Medicare is paying for all this. The budget's not getting better. What would they do so that the numbers don't keep going up, so Medicare doesn't keep spending all this money? What would they do to make a difference instead of just saying, well, we've got dialysis, that should be good enough? Because Medicare is paying far too much on this, and we're not doing anything to really take their budget down. We just keep sticking more people on dialysis, and that's not helping anyone. It's taking away quality of life for these people, and that number continues to grow, and it continues to cost money to the government that if we had real solutions, we could improve quality of life and save money for the government. So that, to me, that's what I would talk to them about, because it's a win-win. You make citizens better and you save money for the government. And I would ask them simply, is that something you agree with and would you be able to get behind? Just because I can't understand anyone that would not agree with that approach. And I would think that's something that all of them on all sides could agree with.
Finally, this executive order, such an important executive order, encourages private enterprises to partner with government to achieve incredible medical breakthroughs. we're going to prioritize a truly transformative goal, the development of an artificial kidney.
Just persevere. It's not going to be an easy road, but it is possible to persevere and get through hard things to better things and continue on, and at times still have a good life despite how bad it might seem at times. You really have to just get on top of it, and I wish there were more people that would advocate for patients besides themselves, but if there are more people that are asking their own questions, then we'll have more patients that are healthier like I've been and able to do things like I've been able to do.
Folks, Brian was special. He was more than a friend, and we appreciate the opportunity to share a little bit of Brian with you. And now I'd like to turn it over to my good friend, Paul Conway, who's going to speak about the purpose of the Policy Summit today. Paul?
Thank you very much, Richard. Richard and I has been a loyal friend and an avid fighter on behalf of kidney patients here in the United States and across the globe in the battle against kidney diseases. The purpose of our annual Kidney Policy Summit is threefold. First, we seek to educate patients and people of goodwill who work alongside them, such as doctors, researchers, social workers, and innovation leaders, on the key issues in the United States Congress and moving across the executive branch agencies that could impact the future of innovation, kidney disease treatment, and patient consumer choice. The second element is we seek to make certain that patients understand that their voice, the independent voice of kidney patients, is powerful, has an impact, and must be represented at every single juncture of policy and in the decisions that are made. It needs to be at the table, not simply listened to, in order to make certain that patients today and tomorrow have timely treatments and innovation. The patient voice must be represented. And the third element is we work actively to remind patients and the people that work alongside them that they are part of a large constituency in the United States public policy process. And what does that mean? It means that 40 million Americans have kidney diseases, and millions more are in families that take care of them. They're among colleagues that work with them. They're in the medical community, and they're in the innovation community and scientific communities. What we're trying to do is make certain that this constituency views themselves as kidney voters, meaning their voice matters and their vote matters in the public policy process. In 2018, AAKP organized the first kidney voter registration drive that had ever been done in the kidney community. It is now the largest. By 2024, AAKP will have registered 500,000 kidney voters. We intend to make a difference in how policy is made in the United States and have a long view towards investments in research and innovation to make certain that the battle against kidney diseases is more than just a talking point. It's actually a center around which people can coalesce, put their energy in, and see a difference in the lives that have been saved and the quality of lives that have been improved. So how do we do this? Apart from educating folks on issues at the Kidney Summit, we work diligently on Capitol Hill with partners like the American Society for Nephrology, like the Renal Physicians Association, like the American Society for Transplant Surgeons and the American Society of Transplantation, making congressional visits, the power of the patient and the doctor working together. We've worked diligently for the past 10 years on joint efforts to make certain that the patient voice is elevated to congressional staff and elected leaders. In just the past 2 years alone, AAKP had set records prior to COVID of over 600 visits on Capitol Hill. We thought COVID-19 would negatively impact those operations, but fortunately for us, by channeling great energy and the enthusiasm of patients and cutting-edge technologies, we were able to keep that number last year, and already this year, we're halfway through breaking the record, and we're quite confident we'll hit over 700 congressional visits in 2021. In 2022, we plan to go even further on that. The reason why this is important is because congressional staff changes over, and they're distracted by a huge number of other priorities. As much as we'd like kidney disease to be the number one priority, in reality it's not. America has many issues that confront it on the international stage and here at home. But what it takes to make certain that kidney disease remains a priority are people like you who are watching, and the organized voice of patients and professionals that work with them, brought to bear on each juncture of the decision process and public policy process. AAKP is a leader in this field, and we're a leader because we work closely with our allies to make certain it's done and done right. The second area that we focus on is building an infrastructure of patients. And what do I mean by that? I mean a network of patient ambassadors, people who are leaders in their field on social media, in person, in meeting, in educating people on kidney disease. Our network of patient ambassadors is world-class. These are patients like you and me, and caregivers and kidney donors, those who have donated an organ out of the generosity and the need to save a life. These are people that every single day work to educate folks, and they work with AAKP to make certain that the independent voice of kidney patients is raised. And now we've launched a global effort of kidney patient ambassadors, because on the global stage, kidney disease has even more dire consequences. In countries that don't have water infrastructure, in countries that don't have other means of assistance for patients like we do in the United States, with a guaranteed benefit of dialysis, patients are left to fight for resources and they're left to fight for care, and so many of them die. It's one of the reasons why we're very focused on making certain that the access to treatments is not simply a U.S. issue or a national issue. We're focused on making certain that the innovations that are being brought forward are available to patients across the world so we can save more lives and impact the quality of life globally. We thank you for watching this and for understanding our purpose. We approach this with a genuine gratitude for all of our supporters and a genuine interest in trying to fight kidney diseases. We will work with anyone, anytime, to make certain that patient care choice is protected and that the independent voice of kidney patients is not only heard and respected, but it is involved at the decision table. Because it's one thing to have a voice, it's one thing to have it heard, but it's quite another thing to have a patient voice impact policy decisions. In order to impact a policy decision, your voice must be at the table. And that's one thing that AAKP has become exceedingly great at. We are very good at making certain that your interests as patients are represented across the policy process. So thank you for tuning in. I think what you'll find this year is that we have focused very heavily on identifying opportunities and challenges to bring in new innovations to you, the patient. We have leaders from some of the largest companies in the world and from some startup companies that are working on unique innovations that are promising and optimistic. And it's part of the reason why we dedicated this year's summit to our good friend Brian Hess. Because Brian Hess was a humble person. I think he would be embarrassed if he knew that we were dedicating a policy summit to him. Because as a humble person, the only thing he was interested in was making certain that patients like him and others who had not been diagnosed didn't have to suffer. He was a noble person, and he was a good soul. And the reason why we dedicate this is because people like Brian are out there every single day working hard. And in their minds, what they're doing is they're simply carrying the torch that patients before them had carried. And they're looking to pass that torch on to others who will join the battle against kidney diseases. Because hopefully someday we'll be at that point where it doesn't impact that many people. But the people like Brian Hess must be remembered because their lives matter and their impact matters. And you, the kidney patient, have the power and the ability to make certain that policy decisions that are made guarantee your ability to be treated in a timely manner and with the best types of innovations that are available. So that's the purpose of the Policy Summit. It's quite direct, it's very lean, and we intend to make certain you have the knowledge you need to be effective. So thank you very much for tuning in, and we hope you like the program.